All right, so when we are looking at aging and the urinary system, okay, lots of different things that can go on, as you can tell by all the bubbles here. So let's look at the urinary bladder first. So as we age, you have decreased bladder size and tone of the muscles of the urinary bladder, which is the muscle that's responsible for the actual release of urine. So as a result, your patients will experience dysuria, urinary frequency, they have a higher incidence of incontinence and also urinary retention. For the kidneys, as we age, you have a decreased ability to concentrate urine. That glomerular filtration rate is going to decrease, and the number of nephrons themselves are going to decrease, and the size of the nephrons. So, because of all of that, the elderly patient or the aging patient is at increased risk for nephrotoxic agents. And we've talked about this all semester about IV contrast. Okay. So, certain medications and IV contrast are going to put their kidneys at risk as well. For the male patient, as you age, the prostate actually enlarges, which means that you're at high risk for urinary retention and difficulty voiding. Females, you are prone to bladder infections, urinary incontinence, and urethral irritation, as well as the pelvic floor muscles weakening. So these are all components of aging in the urinary system that we need to be aware of as nurses. And then these are just the text versions of what I've already said, so you guys can kind of look through those on your own. All right, so for your nursing assessment, okay, so again, we always begin our assessment with a thorough history, and that includes current and past health, family history, and lifestyle patterns. So current health status. So we want to determine the patient's chief complaint. So I always ask, what made you come in today, or what made you seek medical help? You want to document the reason for seeking care in the patient's own words. And when a patient has a renal disorder, you can expect, some common complaints like urinary frequency and urgency, pain on urination, difficulty urinating, and flank pain. You also want to ask about their previous major illnesses, recurrent minor illnesses, accidents, injuries, surgical procedures, allergies. You want to ask about a history of urologic related disorders like hypertension, for example. So I ask questions like, have you ever had a urinary infection? Are you taking any medications, either herbals, prescription, over the counter, or recreational drugs? Do you have pain or burning on urination? Is initiating urination difficult? What color is your urine? Are you allergic to any drugs, food, or any other products? Have you ever had any sexually transmitted infections? Like that is relevant to stuff here. Okay, so we have to talk about that as well. Physical assessment, we always get, vital signs. We're going to listen to lung sounds, especially when we're dealing with patients with kidney disorders. We may have issues with excess fluid, so we're going to listen to lung sounds. We're going to look at edema. We're going to do daily weights because daily weights are the best indicator of fluid status in our patients. And we want to make sure that we do accurate intake and output on these patients as well. Laboratory tests, urinalysis is a very common test that we do. This can be a voided specimen or a sterile catheter specimen. You need a minimum of 10 milliliters of urine collected. When we have a patient with a urinalysis, it's important that we teach our patients to do a clean void midstream catch if possible. If we are doing a urine culture as well, we need this specimen to be as sterile as possible. So we actually prefer a sterile catheter specimen or a straight cath. Urine specimen collected has to be collected before an antibiotic is given, and we use this test to determine what antibiotics will treat and destroy the bacteria. Renal function tests, the big ones that we look at here, serum creatinine. Serum creatinine is the best indicator of kidney function, but we can also look at a BUN or a blood urea nitrogen. You can look at a serum uric acid and a creatinine clearance test, but if you're specifically looking at kidneys, you want that serum creatinine level.